it's Dr. Rhona, and I'm here to talk to you about one of the most common dental problems. Gum recession. Yes, guys, I'm going to talk to you about the 6 things that causes gum recession, what you can do about it, and what procedures are available to treat it. But before I go on, please don't forget to subscribe and like to my channel so you continue to get all the information that you need about things dental and a little bit non-dental. So before we start, we need to actually understand what gum recession is. Gum recession is literally where the gum tissue which surrounds the tooth has moved away from the tooth. Some people describe it as being long in the tooth because they notice their teeth have got longer in height, which by the way it has because the gum has moved away. They also notice they have increased sensitivity in that area, so when they have hot, cold or sweet things to eat or drink, they have a sort of panging sensation. They may also notice a little notch, where the gum and the tooth meet as well. So those are the different signs and symptoms that people get. Now, what actually causes them? Okay, so let's go on to point number 1, genetic predisposition. Yeah, guys, you can actually be born with being more susceptible to getting gum recession. So if you have thin gum and thin bones, it does mean that you're more prone to get it. And so, for example, if you have orthodontic treatment or you brush aggressively, that can cause the gum recession to be even more because of your genetic predisposition. One of the reasons is the genetic predisposition. The second reason is due to teeth grinding. So if you're grinding your teeth, the forces between the upper and the lower teeth can cause the gums to recede as well. People again will notice the notching type appearance in these cases. The third reason could be due to periodontal disease. Periodontal disease is a severe gum disease which basically causes the gum and bone to dissolve. It's permanent and it's irreversible, and that causes the gum recession, and you can't really do anything about it, and it's definitely something that needs intervention and treatment. Point number 4 is having crooked or malaligned teeth. So when you have crooked or malaligned teeth, again, the forces to try and get your bite into a comfortable position means that you could get the gum recession. So what's the 5th reason? The 5th reason is also poor oral hygiene. So for example, if you don't brush well or you're letting plaque build up on your teeth, and plaque is basically, bacteria and food that form that sticky film onto your teeth, it can become hard and it can form something called tartar or calculus. You can't remove that at home, and if you don't remove the tartar or calculus, it can cause the gums to recede, and the only person that can remove it is the dentist. I actually say it's a bit like having lime scale on the bottom of a kettle. It needs to be removed, it needs to be scraped, and that's exactly what we do in surgery. The last reason is aggressive toothbrushing. Yes, being an enthusiastic toothbrusher is a thing. So I always recommend using an electric toothbrush, because if you're using a manual toothbrush, the forces that you exert really brushing your gums away can cause the gum recession. So let's have a summary. What causes the gum recession? It could be due to genetic predisposition, grinding, malaligned or crooked teeth, smoking, which causes periodontal disease. It could be due to aggressive toothbrushing, and number 6, poor oral hygiene. So we know some of the reasons why you get gum recession, but what can you do about it? Well, as I had already mentioned, is that there's severities to the gum recession, and if it's not so bad, it's actually okay to monitor it. Your dentist can monitor it, and he'll educate you about how to brush your teeth. So for example, using the modified Bass technique like I had mentioned, brushing the gum line, not being too aggressive with it all. And also I recommend using a water flosser. I love Water Pick, it's what I've been using recently, and it's basically a water irrigation system that blasts air and water between the teeth and removes plaque and debris. So it's really fantastic and also great to help clean between crowns, veneers and bridges, for example. So that's one of the things that you can do that's super easy, and obviously going to the dentist every 6 months to help remove that hardened tartar and calculus that can cause the gum recession. But that's the easy part, and that's in cases that aren't severe. Now, what if it is more severe? Well, if the recession isn't too bad and you don't mind having it covered, we can also do a little bit of composite bonding where we cover the recession and help it match the rest of the tooth. However, if it is severe, you don't want to have more plaque attracted to the area, which bonding can do. It is better to have a conversation with a periodontist, which is basically a gum specialist, and he can talk to you about surgical procedures available. So for surgical procedures, he may do a very deep clean in any pockets that are formed in the gums, and again monitor it, or he can do a graft. When they do a graft, they basically remove a little bit of gum from the palate, for example, stitch it into the area of recession and wait for healing. They can also do tissue regenerative surgery, where they use membranes to put inside the gums to try and encourage the gums to grow and stick to the tooth. Again, let's have a little summary. Oral hygiene, stop smoking, make sure that you're brushing the right way, and it can be monitored. You can also have a little bit of composite bonding if it's not so bad. In cases that are severe, you will need to see a gum specialist. They do a deep clean and they may do a graft or do tissue regenerating procedures if needed. So that's my little summary, my little whistle stop tour. I hope that's been helpful, and don't forget to subscribe and like to my channel so you continue to get all the information that you need about things dental and a little bit non-dental.